Hello everyone, it's so lovely to see you all. I'm still getting used to in-person events and it's just so fantastic to see real people. A little bit more anxiety-provoking than seeing a number of people on a Zoom call, but I'm getting over that. I'm here today to talk about how to create a company culture that is mentally healthy. What we're going to do is cover a few key areas here. We're going to talk about where are we now, why we need to act, what a good mental health culture looks like, and critically, how to drive cultural change. My name is Dr. Nick Taylor. I'm the CEO and co-founder of Unmind, and I'm also a clinical psychologist by background. Mental health is a topic I'm deeply passionate about. It's a topic that we collectively have to transform for this generation and for the next generation. I'm the co-founder of Unmind, so I'm going to start with about Unmind. Unmind is a platform for changing workplace well-being culture. So we empower employees to live more fulfilling lives while giving leaders the insights and confidence needed in order to create psychologically safe, engaged, and mentally healthy cultures. We are proud to work alongside some incredible organizations, some of whom you'll see up on the screen here, helping them to transform their approach to mental health. As we all know, over the past few years, we've had a turbulent time. It's been one of the toughest periods in living memory, and perhaps something that we won't go through again in our lives. As a result of this period, we have both seen an increase in the prevalence of mental illness, so the problem that we're here to talk about has got bigger, but also an opportunity. And that opportunity is that the topic has become easier to speak about than ever before. We, I think, got better at asking one another over COVID, how are you, and actually meaning it. And that helped us all to have a more open, transparent conversation. Very famous people started speaking openly about mental health, how important and critical it is in their lives, their lived experiences of poor mental health. And it really has helped to unshackle the stigma from this topic, enabling us all to make meaningful change. But we really do need to act. Our current measures simply aren't doing enough. We're not going far enough. And we all know this intuitively, but actually all of the research backs it up as well. We know that over the pandemic, 41% of employees experienced a decline in their mental health. That is a staggering statistic alone. We know that the number of employees at risk of burnout between 2019 and 2022 has increased by 29%. That's almost 1 in 3. And we know that 22% of employers rate their workplace mental health and well-being more favorably than their employees do. So clearly there is a gap. We know those problems are big, but it's sometimes important to remember the impact they have. And the impact is profound. We know that poor mental health is estimated to cost the economy $1 trillion in lost productivity. I simply cannot fathom what $1 trillion really is. It is such a vast amount of money. The impact is profound. That productivity, that opportunity is lost as a result of poor mental health. We know that mental health-related absence is still one of the biggest, most critical problems facing the workplace today. And it's estimated to cost the economy 53 to 56 billion pounds a year. So perhaps it's little surprise and a relief that 96% of firms plan to maintain or increase the mental health investment post-pandemic. I wonder who the 4% are, because I think they need to see the first few slides of this presentation. We at Unmind have spoken about taking a whole-person approach to mental health for years now. It is critical when we think about mental health that we understand it is the whole of the human experience. This model is very famously known as the biopsychosocial model in healthcare. But essentially what it speaks to is that our mental health is made up of psychological parts of our life. It's made up of physical parts of our life. And it's made up of social parts of our life. And you cannot distinguish those things without considering the other parts. My social life, my friends, my family, my finances, my workplace will impact on the psychological inner world It will impact on how well I sleep, how well I exercise, how well I prioritize looking after my physical health. Equally, if I'm not sleeping well, my social relationships will fray. I will likely spend more willingly. These things are fundamentally linked. When we think about mental health, we have to think about a whole person approach. And you'll see here the ring going around: calmness, coping, fulfillment, happiness, health, sleep, and connection. That is the Unmind Index. That empowers employees and organizations to check in on their whole person self and understand how their mental health is. And I'm going to come on to the importance of measurement later on today. So the whole person approach is critical, but we need to also factor in the dual continuum model. Many of us are familiar that mental health is on a spectrum. We've talked about this now for the past few years, but we need to go further than thinking about mental health as a spectrum from something that is a problem here to flourishing here, and actually start thinking about it in a more nuanced way. It's critical to do this, and I'll come on to why. When you think about the dual continuum model, we have two spectrums. We have mental illness on one end and no mental illness on the other. And then we have low positive mental health and high positive mental health. And this gives us 4 quadrants. So on the bottom left here, if you have a mental illness and you have low positive mental health, then you are going to be struggling. That is the group of people that are going to be struggling. However, it is important to remember that you can have a mental illness, but actually have high positive mental health. And you can still have symptoms, but be content. This is critical because by recognizing and acknowledging this group, we will help to break the stigma. Because if our association is, if you have a mental illness, then you are struggling and unable to engage and be productive and be a valuable member of your community and work, then no wonder there's a lot of stigma around the topic. It's really critical to recognize that top left quadrant. Over the past 2 years, a lot has been spoken about people who are languishing. People who actually don't have a diagnosable mental illness and no mental illness on the right, but have low positive mental health. We saw a big increase in this group over lockdown, over COVID. That group is vulnerable and critically needs support. And then on the top right, this is where we all want to be. High positive mental health and no mental illness, and then we're flourishing. So when you think about your employees, think about them from a whole person perspective and think about them from a dual continuum perspective. But fundamentally, whilst that's critical to do that, strategies that only focus on the individual aren't enough. We must go further, and real change fundamentally takes cultural change. So what does good mental health culture actually look like? Well, what it looks like is that it's something that affects every level of your organization, from your top executive to the most recent person to come into your business. Every single level of your organization needs to have this topic as a top agenda. Transforming mental health in the workplace takes a whole organizational approach. So in other words, we have a whole person approach for the individual and a whole organization approach for your business. Those two things together are what help create this healthy culture. So ultimately, when you're going back into your organizations, it's about reminding every single person that cultural change is everybody's business. Nobody should be saying, that's not my priority. There was an amazing report recently published by the Josh Bersin group, the company. And what it showed is what impact a good mental health culture can have on an organization. And the findings are really fascinating. It showed that organizations that have good mental health cultures are 2.2 times more likely to surpass their financial targets. So if you need to persuade your executive team to care, that should get them on board. Organizations are 5.4 times more likely to recruit new talent. They're 3.2 times more likely to engage and retain staff. And I know retention of people is so critical to having a flourishing organization. 5.4 times more likely to have low annual healthcare claim costs, and 10.8 times more likely to boast lower rates of employee absence. So this is why it matters. So it's not just about stopping a problem, it's about grabbing an opportunity. So how do we do this? How do we get to this place? Well, there's 4 critical pieces. The first is measurement. The second is managers or leaders, depending on what language you use in your organization. The third is this invaluable, critical group of champions. And the fourth, of course, is every single one of your employees. Fundamentally, you have to measure well-being because that's how you can manage it. If you can't, you simply cannot manage something that you cannot measure. And it's time that we really moved forwards with this as a topic, as a community of people who are driving this agenda in our organizations. Let's really get measurement at the heart of what we are doing. Every employee and every employer has different needs. We are all different. We're going back to that whole person concept. We are all different as individuals, but each of our organizations is different as well. We all know that some organizations have more one type of worker than another. Some organizations are global, some are not. Some work longer hours, shorter hours, work in different industries, have higher pressure, lower pressure. One size doesn't fit all, but you're not going to know what size to wear if you don't know what size you are. You need to know who you are as an organization. You're only going to know that by measuring. Data fundamentally drives actions, and it guides you towards your well-being goals. And also critically, by measuring and understanding yourself, you're going to be able to demonstrate the impact of your well-being strategy. That critical ROI and VOI, that critical piece of information to engage the executive team, to secure budget, to increase budget, all comes from data. At Unmind, we like to think about this as measure, understand, act. And critically, this is evergreen. This is continuous. This should be a philosophy and approach that is fundamental to your organization forever. Because that is how you're going to bring about the change that you seek. The next piece is upskilling your managers or leaders. It's critical to provide evidence-based, well-being-centered, continuous training. For too long, our approach to educating managers about the topic of mental health and well-being has resembled the Victorian bathing habits more than the 21st century, more than 2022. We are in a world now where we can do things continuously. Let's make sure that we continually equip and educate our leaders. And when we do it, let's remember to educate them about the whole of mental health, not just about mental ill health. If we want to break stigma, let's remember to tell our leaders that mental health is the best thing about being a human being. Our ability to think and be creative and problem solve and feel all the emotions we feel. It is so cool. Let's remember to tell our leaders that, because if we don't, they're going to think mental health is depression, anxiety, and stress and nothing more, and that's a harder conversation to have. It's critical, though, that we do arm our leaders with the insights to recognize and understand mental health problems. As a clinical psychologist who spent many, many years working in healthcare services, I still get anxious if somebody says to me, I'm feeling stressed, I'm feeling depressed. I still get anxious despite years of training. We cannot expect our leaders to feel secure and confident if they did training 9 months ago in the topic. We have to keep them filled up all of the time so they feel confident to recognize and understand mental health problems. And critically, we need to empower them to support people experiencing challenges. If they need to know where to signpost someone, how to support someone, what the best thing to say in a given moment will be. And then also, of course, we mustn't forget that our leaders are also individuals with a whole person world of mental health, and we must make sure that we keep them well. We must mobilize this precious group of people in our organizations, our well-being champions, and they go by different names in different businesses. So let's make sure we know who are our experts and advocates. Let's build a network of them. Let's connect them to other networks so they can learn best practice from their colleagues in other organizations. Let's share best practice amongst us all as organizations. This isn't a game where one organization should want to win. This is a game where collectively as a society we have a responsibility to change the world when it comes to mental health. Let's make sure that we listen to other people's experiences. There's so much wisdom to be shared and to learn from one another. And let's make sure that we continue to encourage best practice through webinars, events, and really know what works for your people, for your champions, to make sure they feel empowered. And finally, there is so much value As we all know, I'm sure everyone here could put their hand up and share around this. There's so much value in encouraging senior leaders to share their own experiences to help them smash stigma from the top down. It normalizes the topic. Let's make sure, however, that we don't forget to empower our people. Fundamentally, employees need tools. I've got it, thank you. Employees need tools to manage their own well-being. Absolutely critical. But we've got to shift our focus from traditionally the reactive model, wait for somebody to get ill and give them support, to a proactive model, to an early intervention model. We all put sun cream on when the sun shines. We all wake up and brush our teeth. We all prioritize eating well, sleeping well, exercising, because prevention's better than cure. Same in mental health. Let's prioritize a proactive approach with our mental health for our employees. Let's make sure that we offer variety. One size does not fit all. The best-in-class mental health strategies look much more like a jigsaw puzzle than a photograph. Lots of pieces to make sure that the variety will meet people where they need to be met. Let's make sure the science is solid. Science is at the heart of mental health. Every provider should be able to back up their science. That is so critical. So, so critical. Let's make sure that we integrate services and connect. If you went to your doctor and you said, I have a bad back, and they said, I can't help you, I'm not a physio, you would probably complain. You rely on your doctor to say, let me make a referral. Let's make sure that services connect up with one another, because that provides integrated care, and integrated care provides the right care at the right time, and the right care at the right time provides the right health outcomes. Critical piece. So, it is so fundamental that when we want to create cultures where employees and organizations thrive, that we take both a whole person and a whole organization approach to this critical topic of mental health in the workplace. If you'd like to learn more, please do download our recent white paper. You can scan the code here, which I didn't know worked from such a distance, but you can apparently do that. And also, we have our team out on the stand there. So if you'd like to go and have a conversation and ask any questions, then please do come over and chat with us. Thank you all so much for listening. It's been great seeing you all today. Bye-bye.